My name is Elvis Eberti, and I'm currently working in the rheumatology department of Santa Chiara Hospital in Trento and at San Raffaele University in Milan, both in Italy. And I've worked at Mayo Clinic Rochester as a research fellow. I'm here to talk about my paper entitled Risk of Cardiovascular Disease and Venous Thromboembolism among Patients with Incident ANCA-Associated Vasculitis, a 20-year population-based cohort study, which is going to be published in the next edition of Mayo Clinic Proceedings. I would like to thank my co-authors for the guidance and constant support they provided me throughout this project. ANCA-associated vasculitis are a group of systemic necrotizing vasculitis, which usually affect small and medium-sized blood vessels. Patients affected have usually a greater risk of cardiovascular disease and venous thromboembolism. So, we performed this study to better define the risk of cardiovascular and thrombotic events in patients with ANCA-associated vasculitis. In the Olmsted County, Minnesota, over the last 2 decades, the incidence of cardiovascular disease and venous thromboembolism in patients with ANCA-associated vasculitis have been compared to age and sex-matched comparator subjects without vasculitis, randomly selected from the same population. The risk of incident cardiovascular disease adjusted for age, sex, and calendar year was approximately 3 times higher among patients with ANCA-associated vasculitis compared to controls. By disease subtypes, the risk was increased by cardiac events overall, and of note, this finding was driven by heart failure, with a significantly higher incidence in patients compared to controls. Ischemic cerebrovascular accidents were significantly increased, as well as the risk of deep vein thrombosis. In the ANCA-associated vasculitis cohort, the incidence rate of overall cardiovascular events was highest in the first 2 years of follow-up and gradually declined thereafter. At baseline, vasculitis-related factors didn't per se increase the risk of cardiovascular disease, while the traditional cardiovascular risk factors such as obesity, older age, dyslipidemia, diabetes, associated to cardiovascular events in patients with ANCA-associated vasculitis. For the clinician and patient, active monitoring for any cardiovascular disease and venous thromboembolism and traditional cardiovascular risk factor modification are recommended, especially early after the diagnosis of ANCA-associated vasculitis. Thank you, and I hope you will enjoy our article.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.